Welcome, Hampstead. Tonight is Thursday, July 29th at approximately 7:30 p.m. We are going to start our special meeting, and if Melissa, you would mind taking the roll call?
Sure. I'm going to start to my right and just work my way down. So Jay Giard.
Here.
Erin Pellegrini.
Here.
Megan Malcolm.
Here.
David Smith.
Here.
Caitlin Parnell.
Here.
And also seated at the board table is Superintendent of Schools, Bob Thompson.
Thank you, Melissa. Stand for the pledge, and Caitlin, you want to start us off?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, so we have a shortened agenda tonight. Most of these will be coming from Mr. Thompson to give us updates, so I'm going to turn it right over to Mr. Thompson to talk about school reopening, the HCS renovation, and strategic plan updates.
Wonderful. All right, thank you and good evening. Just to update the board and members of the community on a few items. First, I'll start with our reopening of school plan for the 2021-2022 school year. So back in June, we submitted to the Department of Education a safe return to in-person learning plan. And as I had indicated in June, this is a plan that will evolve over time, particularly as we get closer to the start of school. And so we have made some revisions to that plan. Those revisions that plan is online with the revisions, and I also intend to send that out to parents tomorrow afternoon in a communication. But just to highlight a few of the changes and the rationale for the changes. So last week, the Department of Health and Human Services hosted a partner call with school districts, and in it they provided some general guidance to school districts. One of the major changes that you'll see this year in comparison to last year is that the Department of Health and Human Services is encouraging local decision making when it comes to their COVID response. What we saw last year was there were New Hampshire guidelines that were provided. This year, given the conditions that exist, they really are looking at more of local control around decision making and what they specifically call local community assessment of risk. So I just wanted to highlight a couple of pieces of that plan. First, the one that seems to garner a lot of attention is masks. We will continue to offer next year a mask optional environment within our schools. We believe that that's a parental choice, and we'll continue to move forward with that. There is one exception to this, and that is the Center for Disease Control has issued a mandate that all public transportation, people who access public transportation, both in terms of drivers and passengers, must wear masks. So that the implications of that are that any child that rides a school bus, whether in transit to and from home or on a field trip, will be required to wear a mask. Also, there's been some changes or questions that have come up around quarantine. We will continue to have students who test positive. They will have to quarantine for 10 days. There is a minor change, and that is really around exposure. If a child is exposed to somebody, and the definition, according to Health and Human Services, is 10 minutes or more of contact of 3 feet or less to an individual that is positive for COVID, students no longer need to quarantine if they come into contact with someone who has tested positive. It is the obligation of the school district to notify parents that their child has come into contact with someone who's COVID positive, and the parent can make the determination whether or not they want their child to quarantine. There will no longer be any whole class quarantining because a student tests positive. And the determination for someone to test for quarantine will be made by the Department of Health and Human Services. And, so those are the major changes in terms of what Department of Health and Human Services is recommending. Again, I want to put it out there that this will change. I'm going to be meeting with members of my administration on Monday, where we're going to go through the revised plan. I'm also meeting with members of the association and the school nurses. There is also a follow-up call with the Department of Health and Human Services on August 11th. And after that call, I could foresee us making some additional changes to the plan. And with that said, I'll open up to any questions that folks might have in regards to the reopening plan.
The only thing I was hoping maybe you would just touch on, just for parents, just so that they're aware, is the sort of the information we received about what we are allowed to do. Basically, the one where it said what we implement at this school, we have to implement at this school. So I just kind of wanted that clarified. So because obviously some kids at the middle school level can be vaccinated, and the younger kids cannot. So I think I just want to kind of make sure parents are aware that we have to follow the same thing for both schools.
Absolutely. So in the spring, House Bill 220 passed, and that's called the Medical Freedom Law. And essentially what that says for school districts is that we have to universally apply masking mandates. And what that means is we cannot target specific populations, whether that's vaccinated or unvaccinated. But what that also means is we can't even target specific grade levels. So a school district would have to universally apply a mask mandate. So if we were to move to a mask mandate, that would have to be universally applied pre-K through grade 8.
Thank you.
Other questions? No?
So there's a lot of information changing every day. I am pretty frustrated that we're still at the point that we have information changing every day. But I have to bring up that we have now had pediatricians and the CDC coming out with recommendations that everyone be masked in schools. I understand that guidance a lot of times is also following whether it's a hot spot or not. And I don't believe last time I checked that New Hampshire, or at least Rockingham County, was a hotspot at this point. I guess I just would like to ask you to speak to that a little bit, especially for parents who have concerns with the variant that we're seeing that's more contagious. I know you mentioned the August 11th follow-up with the state. So I guess what are your guidelines going to be for considering this as we go?
Yeah, absolutely. No, it's a great question. And so, again, Health and Human Services is leaving it up to local school districts based upon local community assessment of risk. Now, what I look at in terms of determining that is the 7-day positivity rate, which today is 2.4%. That is very low. Obviously, we'd like that number to be 0, but when you compare that to other areas of the country, that is relatively low. You also look at the daily case count. Yesterday there were no new cases in Hampstead. There is a total of between 1 and 4 cases overall. So I'm very comfortable using those metrics to be able to remain with a mask optional mandate. Now the question that people ask is, well, what numbers do we have to get to before we make it mandatory? And I struggle to answer that because it's not always black and white. There's a number of factors that we would need to consider. I think what we're seeing in New Hampshire is there is very little school-based community spread of COVID in the previous school year. And so that lends itself, I'm comfortable with the mask optional procedures that we have in place, knowing that we may have to evaluate, and it will be based upon looking at the 7-day positivity rate and the number of local cases.
So as a follow-up, we had talked last meeting or the meeting before about the potential, if we had the numbers, for opting into a masked classroom. And I know that when you updated us about the state call and that we have to treat everyone the same, are we still considering, if we have the numbers, to support a classroom, say, per grade, where parents could opt into a classroom like that?
Yes, and my communication to parents that is forthcoming will ask them, first I want to get a sense of how many parents are going to have their children wear masks to school. We need to start with that. You know, and based upon that data, we'll determine the feasibility of doing a mask classroom. We have to be very careful because we don't want to run into issues with the medical freedom law. That would something that would have to be done voluntarily. We could not mandate that. And the other piece too is we have to determine, you know, our elementary schools are a good example. You know, class placement has already occurred. And if we were to move to a mask, you know, required setting, you know, how does that affect a child's placement within a classroom? And are parents comfortable with having to make some adjustments to previously established class assignments? So
Was
there's a
that
lot of
something-
moving pieces.
Okay, and is that something that you would, like, if you're going to send out a survey,
Yep.
that you would, I'm assuming, ask parents, are you comfortable if your child has to move,
Yep.
teacher assignments, et cetera?
And Dr. Cheney and I actually met today to discuss what that survey would look like. It will be brief, but we just want to first gauge the interest of parents, and then we can make some determinations about whether we move forward with that.
Yeah, I think I would just ask that the surveys, so some of the surveys that have gone out in the past were not worded well, where maybe two questions were put together so that you kind of had to answer one, you answered the other one, you didn't
Yeah.
really want to answer the other one that way. So, you know, just want to make sure that the questions are single questions, you know,
Clear,
Clear.
succinct questions.
Absolutely.
clear, simple, right.
Yep.
So you actually get the data, the right data that you're looking for.
Right. I do have two questions about quarantine, and I'm not sure if you'll have the answers because I know this is new information, but first question is about the students that have to quarantine. We have a child that quarantines 10 days, that's 2 weeks, essentially, that they're going to miss out on education in the classroom. I'd like to know, if not now, but maybe the next board meeting, as we prepare for the school year, what does that look like for the student, so that we're supporting that student and they don't have a loss of learning of 2 weeks.
Absolutely.
So that's the first one. The second one is about the quarantining, and I'm thinking of me as a parent. If in my child's classroom a student tests positive, my student or my child is not within the 3 feet, is not deemed 3 feet, I'd probably still want to know there was a exposure in the classroom, even though they're not in that 3 feet space. Is that going to be part of the communication? Can we do that communication? Like, what are your thoughts there?
It depends. So what we have to look at, and this is can often be frustrating for parents, we have to balance the privacy rights of students with the need to know within a classroom. And so what that can sometimes look like is if notification to an entire class of parents will identify specifically who that student is, we may not be afforded the opportunity to let all parents within the classroom know. Now, with the guidelines that recently came out from Health and Human Services, we are obligated to let close contacts know. So that generally would be the students that sit around, within close proximity of that student. It would be my hope that we could notify a whole class, but we have to look at it on a case-by-case basis.
Yeah. So I guess my follow-up to that is, I would think that if it's the close contacts, that's more apt to know who the student is.
Absolutely.
Versus if you notify the entire classroom
Yeah.
parents, hey, there was, but your child was not deemed close contact, but we're letting you know as an FYI. That's where, even as a school board member, I would think we need to do that.
Yeah.
So I would ask that we consider that and discuss what that protocol is for before school opens, so that way parents have an understanding of the expectation going into the school year.
Yep.
I mean, I think of it no different than, again, I hate to say like the flu, but if we had a flu pandemic in the school, like it's just running, we'd probably do the same thing. There was a number of students in the classroom with the flu. Please watch your student, your child, to make sure they're not exhibiting any of the symptoms. Same thing.
Yeah, to the greatest extent, Paul. Our goal would be to be able to do that.
Okay.
If that child the next day is the only child out in that classroom, it becomes self-identifying that child has COVID.
Yep.
So it's one of those things where, and that's why the answer is it depends, because we always have to balance those two with the hope of being able to provide parents with the information that they feel they need.
Okay.
Yeah.
I have a question that shouldn't have to go to you, but you're providing the info. So I want to make sure I'm understanding this correctly. the state is saying, or the CDC, I'm sorry, I can't.
Department of Health and Human Services.
Yeah. They're saying that if you're a close contact, you don't have to quarantine?
You're not required to quarantine.
Okay, so I just have to say, I have a huge concern about this.
Yeah.
In a setting, especially with younger children. Again, I know this is not
Yep.
you, this is just something I think we really need to be looking at and considering. And I totally agree with you of what you said, Mr. Thompson, about last year. We had really low transmission in schools, but they were masked.
Yeah.
And I get, the community level is lower. I'm not at all arguing that. I think this is something that continues to change. There are just pieces of this that I'm uncomfortable with at the state level, not so much as what we're trying to do. I just don't want to end up in a situation where we have to go back to remote learning for a short period of time. Nobody wants that. Like, that is the thing that the most that I have heard is we do not want back to remote learning. And I'm trying not to interject my own feelings here because I don't particularly have a huge issue wearing masks, but I want an optimal environment for our students, and this seems like it's setting schools up for an issue.
But I also look at private schools and other schools that didn't mandate masks like we did. They didn't have these issues. They
They
had
have smaller populations too.
not. I wouldn't say that 100%. I'd say there are private schools that were, I'd say, at max capacity, close to it, that were having their students 3 to 6 feet apart, and they didn't have this. And I think that following the guidelines we put in place of the cleanliness, separating when possible, those kind of things still have to be put in place, and I think that's going to aid us. I could be wrong. There could be some symptoms. There could be some outbreaks coming up. We just don't know. But
Yeah, and there are, a variety of other mitigation strategies, and this is part of the conversation I'm having with
Right.
building administration. One, to address David's concern about, a child that's out for 10 days. We need to be able to address that. What do we do for a child that has to quarantine? But also other mitigation strategies that we can put in place. And if a situation were to arise, we may have to move to a mask mandated situation, and under the law, it may not be a single class. It may have to be the whole district to address a specific case. I could foresee that happening. So we can't take, even though we will start the year with masks optional, we can't take it off the plate as a potential mitigation strategy depending on what happens with this guidance.
And so if the, kind of working off of what Caitlin was just saying about the close contacts not having to quarantine, but their parents could choose to, correct?
They can.
And if they choose to, then they would be, however we're going to deal with, the learning part of it, they would obviously be able to partake in that.
Absolutely. And the district, also to be clear, we can recommend that they quarantine.
Okay.
We do not have the authority. That authority is designated to the Department of Health and Human Services, the actual quarantining of students. And that was true last year, even though schools took great liberty with that. But we can recommend to parents that if their child was exposed, one, that they get them tested, and two, that they quarantine.
okay.
Yeah, I think I see kind of what Caitlin's saying there too, because if you have, someone's positive, someone's sitting right next to them, but they're not quarantining, but then they're actually positive, well, then that person next to them is, that could have
Domino.
Yep, absolutely.
quite a ripple effect.
All right. So your next meeting is on the 11th.
With the Department of Health
The
and Human
department.
Services, yeah.
Okay. I think at that point, we'll have to figure out, do we want to have a meeting, a special board meeting following that, or wait until the 24th, which is our next scheduled meeting? So I think we use that as a litmus test of what we do next. All right? Does that sound?
And also, just one other piece in terms of reopening. I today was in contact with the Department of Health and Human Services and have begun discussions with them about the potential for doing an on-site vaccination clinic for our elementary school students when the vaccine becomes available. So there's a lot of logistics, and I've been told that right now, we've reached out early in comparison to other districts. There's a lot of logistics that need to occur, but that is something that is in our reopening plan, to be able to provide parents an opportunity for their child to be vaccinated on site.
Okay.
So we're exploring that.
All right, thank you.
Yep.
Any other questions on the reopening? All right. I guess the only thing I'd say is I appreciated, I got the email, like all other parents, about, and as a board member, of the, I forget, the summer program, that's going to be the 2 weeks in August. So that was appreciated, and hopefully you've got good responses from parents, and, you've started seeing some of that coming in.
Yep, absolutely. No, we're very excited about the Summer Academy.
Yep. So, all right. Let's just go to the next agenda for the renovations.
Yeah, so the, for those of you at home, and I know many of you are well aware, we have a renovation project going on at the Hampstead Central School. Basically involves putting up new exterior walls to drastically improve the heating and cooling system, a new HVAC system, roof replacement, new windows, and overall airflow improvements. So that project, currently they've just finished the demolition of the first and second floor. Next week they're going to begin the demolition of the roof, and they'll start to install the new ductwork. Overall, the project is on budget, and our timeline for completion, as identified at the beginning of the project, is the end of October for major projects, into early November for more of our punch list or our smaller items. A question that people have asked is, they see a lot of media attention around escalating construction costs, and according to our contractor, that hasn't been the issue. We've been able to secure materials at the prices that we were originally quoted, which has been very helpful. What we are seeing is a slight delay in the arrival of some materials. For example, the windows. Originally, we were told that the windows would be here in early August. Then the revised date was August 20th, and now the revised date is the end of August. I have been assured by the contractor that this will not impact the start of school, even if this involves having to work second shift on weekends, bringing in additional crews to get those windows installed, and also a contingency plan. If there is another delay in the windows past the start of school, we can install to code different windows, temporary windows, that would at least allow for us to open school. So right now, that's the one item that is of concern, is the windows, but it is not our intention to have to delay the start of school because of the renovation project.
Good. That's great to hear. Any questions on the renovation project from anyone? No, it's great that it's finally coming to fruition,
Yeah.
so exciting.
Yeah, absolutely.
All right. And then the last agenda item, strategic plan update.
Yeah, so as many of you are aware, we are engaged in the strategic planning process. In June, we identified a vendor to help facilitate and support that work. I've met with the vendor along with Nicole Tomaselli, our Director of Curriculum, and essentially we created a framework. So we'll have a steering committee that is made up of 10 individuals. We have yet to identify who those individuals are, although they are a broad and diverse group of representative stakeholders. And we've selected several dates for us to meet. It'll be a combination of both in-person and Zoom meetings. We are looking to begin the first steering committee meeting at the end of September. We're going to let teachers get settled into school, and then we'll begin that work. And our target would be to bring a completed copy of a strategic plan to this board at the end of January. And so I'm asking, I'm going to be sending out an invitation to any parent or community member who would like to serve on a focus group that will inform the steering committee. So if that's work that you'd be interested in doing, we really value the community and parental input in the development of the plan. This is a community plan. And so any parent, any community member, if you want to be a part of the strategic planning process, we will find a role for you in one capacity or another. We'll also be that focus group of parents and community members will be developing a survey tool so that we ensure that when we write the strategic plan, it's done with the input of any and all community stakeholders. Any questions on the strategic planning process?
So other than saying that Aaron will be representing the school board on that, That's official. That's probably the only name that we have right now besides yourself, Bob,
Yeah.
that they'll be on that steering committee. So, congrats, Aaron.
Great. And then if I could, I just real quickly, I just wanted to update the board on the superintendent entry plan. So it's hard to believe, but we're actually almost a third of the way through the 90-day plan. It's been almost 30 days that I've been on the job. And I continue to make progress towards the 4 goals. Without question, the best part of this entire process is all of the individuals that I've met, the parents and even students and teachers, community leaders. I've met with, the list is endless. I've met with the Board of Selectmen. I've met with the fire department. I have, last week I had the opportunity to sit with the faith leaders and talk about issues facing students in Hampstead. We had a really powerful conversation. Yesterday, I had the opportunity to meet Rob Morris, the town historian, and tour the Historical Society. It reaffirms everything that I've already said about Hampstead. It's a very unique community. There's a ton of pride in this community. And so I say this because I extend that invitation to parents, community members. I welcome the opportunity to meet, to sit down. I'd love to hear your perspective on all things Hampstead as we work towards the completion of the 90-day superintendent plan.
That's good. Thank you.
That's all I have.
It's a great update.
Yeah.
All right, at this point, we're going to close out the public meeting. I will be looking for a motion to enter non-public under paragraph 2L for legal advice.
So moved.
All right, motion by,
Second that.
right. Melissa, would you mind taking the roll call?
Mr. Giard? Yes. Ms. Malcolm? Yes. Mrs. Parnell?
Yes.
Mrs. Pellegrini?
Yes.
Mr. Smith?
Yes.
Okay, thank you.
All right. I do believe we'll be coming out of non-public and making a vote in public. So for those that want to come back and... All right. We are now out of non-public. We will be looking for a motion from Yard.
Yeah, I'd like to make a motion to seal the minutes from the non-public session tonight due to divulgence would likely affect adversely the reputation of someone other than a member of the board.
I'll second.
Yep. Mr. Giard?
Yes.
Mrs. Pellegrini?
Yes.
Ms. Malcolm?
Yes.
Mrs. Parnell?
Yes.
Mr. Smith?
Yes.
Thank you. Motion carries.
All right. And then another motion.
I move that the SAU 55 Board waive any statutory privilege under RSA 91A:5 only as to the Butterfield report itself. I further move that in light of the underlying Superior Court order pertaining to the Butterfield report, the SAU 55 Board vote to disclose to the public a redacted copy of the Butterfield report investigating former SAU board members, and that the redactions shall include A, personally identifiable information concerning current or former SAU personnel, as well as personally identifiable information regarding other individuals whose privacy interests outweigh the public interest in their identities, and B, personally identifiable information concerning students and/or student records.
I'll second that motion.
Would the board like any discussion?
Yeah, any discussion on this? All right.
Mr. Giard?
Yes.
Mrs. Pellegrini?
Yes.
Ms. Malcolm?
Yes.
Mrs. Parnell?
Yes.
Mr. Smith?
Yes.
Thank you. Motion carries.
All right. And I believe that concludes our public session, and we are looking to adjourn. Thank you very much.